Hello and welcome to another live broadcast with MedStar Health. My name is Mishan Carter, and I'm glad you're joining us today as we discuss MedStar eVisit Telehealth, 24/7 virtual urgent care. MedStar eVisit Telehealth offers fast, simple, and secure telehealth services that connect you to trusted MedStar Health providers anytime, anywhere in our service area. MedStar eVisit delivers same-day virtual care from your phone, tablet, or computer. Whether you're dealing with minor illnesses or injuries, urgent health concerns, or you need medical advice without leaving home, MedStar eVisit is a great option. So let's learn more about it together. We're joined today by Dr. Ethan Booker, Chief Medical Officer for Telehealth at MedStar Health, and a Senior Attending Physician in Emergency Medicine at MedStar Washington Hospital Center. Dr. Booker has been with MedStar Health since 2005 and focuses on advancing telehealth, connected care, and health innovation. He also helps lead innovation efforts through MedStar Institute for Innovation, where he serves as the medical director of Telehealth Innovation Center and the Care Innovation Lab. His work includes national research and leadership in telemedicine, including a major AHRQ-funded study on safe and equitable telehealth for chronic conditions. He's passionate about transforming healthcare by expanding access to care and improving how care is delivered for patients and clinicians. So welcome, Dr. Booker. Thank you so much for joining us today. I'm glad to be speaking with you.
Mishan, great to be here.
Thanks. All right, so let's get started. We're going to talk about accessing the care that we need and just give an overview about the urgent care options that exist and when it's best to use them. Calling 911 is the proper course of action for anything life-threatening, any emergencies like that. And primary care providers should be patients' main contact, but after hours or when patients need urgent healthcare needs, where do you turn to? So this is a great option. Dr. Booker, for someone who's not sure where to start, when should they choose a virtual MedStar eVisit?
Yeah, I think Mishan, that the key point there is when someone's unsure, right? I
Yeah.
think, MedStar Health has worked really hard to make sure that we deliver options for care, right place, right time, right set of skills when patients need them. And that means, obviously, as you mentioned, we have our emergency departments that serve communities with that highest acuity need. Urgent
Mhm.
cares, 34 of them spread out throughout our entire footprint, and a very large and active primary care group that also offers telehealth. But MedStar eVisit is a 24/7 platform that can be accessed, like you said, in lots of different ways, where you can see a MedStar provider, usually with a wait time of 5 to 6 minutes.
Oh, great.
Particularly for someone who's already downloaded the app and has registered, and someone who's done a visit before, very quick to see somebody. And they are able to take care of a lot of the kinds of common things that people would be seeking care for acutely. So, simple infections, allergies. This time of year, we're beginning to see things like tick bites.
Oh, wow.
Often
Okay.
one of these things where you're, oh my gosh, I found this thing. What do I do? What
Mhm.
do I need to do about this? Those kinds of things where folks are unsure. And I would always suggest that there are certainly circumstances where people know exactly what they need. I
Okay.
know that I need to go to an emergency department, and that's where I'm going to get started. And patients are actually very good about this. MedStar eVisit transfers only about 2% of patients, a little less than that, from a telehealth visit to the emergency department. Patients are
Okay.
smart about knowing where they need to go. But we'd rather you start
Right.
being uncertain. And so we try not to winnow down too much what we say about what we can do. But there's really a lot of opportunity for us to help route people if we need to.
Okay. That's good to know. Very good to know. What makes MedStar eVisit different from going to urgent care? I think you touched a little bit on this, but could you expound on
Sure.
that?
And I think, our MedStar Health urgent cares are exceptional at providing services. I navigated a friend of mine over the weekend to one of our Health urgent cares when she had a knee injury. And pretty obvious that she needed an x-ray. And
Okay.
so obviously the right thing to do to go and be in an urgent care where they have that capability. And she was in and out in about 70 minutes with an X-ray and a diagnosis and all the things she needed. So I think we do an exceptional job of pace and speed and
Okay.
availability in lots of our offerings. But again, as I mentioned before, MedStar eVisit, usually just a few minutes to get started. And they're 24/7, 365. And so the differentiator here between a telehealth visit and an in-person urgent care is really the immediacy, the ability
Mm,
not to leave home. I mean, obviously,
right.
much of our volume growth and much of the cultural change around telehealth was related to COVID when folks were staying home to get care, and that was the right guidance. And so the difference there really is, when I need care from home, when I think home is a place that I can actually get that care, when I need reassurance about what to do next, it's the middle of the night, I'm not sure what to do. My kid is having a problem that I'm not sure where to
Mhm.
start with. A pediatrician's office isn't open. All of those questions of bringing the capabilities, the very broad capabilities of MedStar Health into a patient's home, like that's the real differentiator. And it differentiates a bit from urgent care, but I hope we also get an opportunity to talk about how MedStar eVisit is different from other options of virtual urgent care.
Yes, yes. We'll definitely dive a little bit deeper into that as well. Going back about your point about the capabilities and the options that are available with MedStar eVisit, can your doctor prescribe medication if
Yep.
needed? Is that anything available?
Absolutely.
Okay.
So, just like if you're going in to see your primary care provider in an urgent care, MedStar eVisit is embedded within the health system, and that means
Mm,
electronic prescribing, knowing what your pharmacy is, pulling in your allergies, all the things that make for safe and effective prescribing are part of MedStar eVisit. Now, there are some things that are different about MedStar eVisit that are important to call out. Um, MedStar eVisit providers will not prescribe controlled substances. And I think you can
mm,
probably understand the sort of
hmm.
reason for that, the safety of
Correct.
making
Yeah.
sure you have an established relationship for a controlled substance like certain types of painkillers or muscle relaxers, really not the appropriate place to be getting that kind of care.
Right.
But antibiotics, if they're appropriate, allergy medications, if they're appropriate, many of the things that you would be getting as prescriptions for these kinds of acute issues are the kinds of things that prescriptions are being written every day by the
Okay.
MedStar eVisit providers.
Oh, that's great. And you going back to your point, your story about your friend and their knee and needing that X-ray. When should someone skip MedStar eVisit and go straight to urgent care?
Yeah, I think probably in this particular circumstance, my friend called me and I navigated, right? So she
Right.
might have had a little bit of an advantage. But I think those are the kinds of things that can often be the right differentiator, right? So
Okay.
again, our MedStar Health urgent cares have X-ray on site and available. Um, they also do a good number of procedures on site, right? So if you might need a few stitches or staples or something like that, that's procedural. Urgent care is obviously the right choice.
Okay.
It's often difficult for folks to know, though, exactly which to do. And I would rather them start with MedStar Health and help us navigate them than to sort of spend too much time trying to figure out what's exactly the right thing for them to do. The whole point of creating this capability of being accessible is to help navigate that circumstance. Obviously, as you mentioned before, crushing chest pain, symptoms of stroke, those are 911
Hmm.
emergency department kinds of activities.
Okay.
Um, so there are some pretty clear distinctions, and I do think again that patients have gotten pretty savvy about this. Um, and have sort of begun to understand, what can I do a telehealth visit for? What's an urgent care for? What's an emergency department for? Um, and we try very hard to make sure that any door that you come in and get started at, we make sure you get to the right place.
I like that. I like that. That reassurance is helpful as a patient myself to know that, you're going to be navigated, you're going to be taken to the right place
Absolutely.
and make sure that your whatever ailment you have, uh, MedStar Health, that our providers are going to take care of it for you. Speaking about emergencies, what are those signs that it is an emergency and not appropriate for e-visit? You talked about crushing chest pain, anything. I imagine an injury where you're bleeding, where you need to see,
Right.
maybe get stitches, or your kid has a very high fever, or uh, could you delve a little bit deeper into like
Yeah,
any other
so
signs that we need to look out for?
yeah, I think that again, I think folks are pretty good at understanding which is which. And for those very serious and very acute illnesses, like I said, chest pain, signs of stroke, like bleeding that can't be controlled, altered mental status, meaning that like,
Okay.
my family member is not behaving in a way that makes any sense. Can't wake somebody up. Like th those things that are really clear-cut emergencies, that's what emergency departments are for. Um, I think though what I have found interesting now, we MedStar eVisit has been providing services since 2015. I think a lot of people think of telehealth as a sort of COVID and post-COVID phenomenon, but we have been in this business for 10 years. And we've delivered tens of thousands of visits for all kinds of reasons. One of the things that has been interesting to us over time is those patients who actually do, in fact, end up needing an emergency department, who have, they're not sure what to do. They have abdominal pain. They
Mhm.
have some problem from a previous procedure or some complication of a previous illness. They're not sure exactly where to start in the context of being embedded in a health system. Again, not a standalone virtual urgent care that you can just get from anybody, but embedded in a health system is the ability to say, oh, I see that you were just in the hospital. Oh, I see
Mhm.
that you're following with your primary care doctor for this thing or that thing. And then being able to route people to say, there's something here that's concerning. Last week, able to identify a patient who had a pretty complicated blood flow problem in their intestine
Mhm.
that would not have been apparent to the provider if they hadn't had that context.
Okay.
And so like there certainly are some things that patients know this is an emergency department thing, or this is an urgent care kind of thing, or this is a thing I can see my primary care doctor about sometime next week. But again, come on in, right?
Okay.
Like
Right. Better to go in.
any door is a door where we will help you to find the right thing.
Okay. It's best not to ignore it, under any
Absolutely.
circumstances, that's for sure. And what would you say to anyone who may be on the fence, maybe they're a little hesitant, they already, maybe not keep up with their doctor's appointments. They're afraid of what news they might get. What would you say to them, who those people who are hesitant to try telehealth for the first time?
Yeah, I think those folks are fewer and fewer, which is good.
Good.
Think a lot of patients have had more experience, not just with getting their health care over video, but really
Mhm.
engaging a whole host of things via internet, um, via video. And so I think a lot of the cultural change has happened, but there certainly are some folks still that may have some hesitancy. And I think that there's sort of two or three items about that hesitancy that I think you can do your best to address.
Okay.
For instance, if you ask patients, would you be willing to see a doctor over video for a certain type of condition, you'll get a lot of hesitance. If you say, would you see your doctor over video,
Mm,
you'll get a lot more enthusiasm for that. And I think that's
okay.
a big portion of why MedStar Health and MedStar eVisit are different than, say, whatever you could get on the web for services. We are your doctor, right?
Hmm.
Now, it may not be that the person you see on the video is exactly the same person that you go to see in your primary care office, but there's a relationship there and a continuity that's through your records that make it your doctor. And I think that's probably the biggest hurdle. The technical ones are real,
Hmm.
but the trust is the most important part.
Hmm.
And so I think we've tried very hard also to make the experience as good as it can be in terms of a technical one, meaning relatively easy to download the app to get started. We work very hard on making sure that we ask the minimum necessary information to make sure we know who you are.
Okay.
to create a registration. But the registration process and getting started is about as easy as most other things you might do on your phone. Now, obviously, we take privacy very seriously, and so it might be a little harder than just simple browsing.
Hmm.
Um, but I think the entry points about hesitance are often also personalized, meaning
Okay.
I'm not sure that I could give a guidance for absolutely every sort of hesitancy, but I'm also confident that anybody that we could engage with, we could say, well, what else are you doing online? How else are you engaging? Are
Hmm.
you FaceTiming with your grandkids? Are you like, how do you do your banking? Like, what are the other things that you might have an internet experience with
Right.
that makes it easier for you to do this? I mean, there are so many things that we've moved from a very analog, very in-person experience to a virtual one.
Hmm.
And I think it's important that we as a health system continue to make every effort to make it as easy as possible for our patients to stay connected with us.
Okay. Very important points. And thank you for explaining that. So we mentioned how MedStar Health has, multiple ERs and more than 30 urgent care locations in the DMV area, as well as MedStar eVisit, which is available 24/7. It's virtual urgent care. Can you tell our viewers who can use MedStar eVisit?
Yeah, anybody.
Okay,
So,
awesome, awesome.
yeah, so MedStar eVisit is available in DC, Maryland, and Virginia, and that's the
Okay,
entire state of Virginia and the entire state of Maryland, not just the
okay,
the communities we serve, because like sort of just locally, but broadly for the whole state, because our providers are licensed in all three of those states, which is an important part
okay,
of safe and effective delivery of telehealth to be licensed where the patient is.
okay.
We're a regional health system, so we don't have a nationwide footprint of where you can access services. So we're not providing services outside of the district in Maryland and Virginia for MedStar eVisit. Um, our MedStar eVisit business is inside of our primary care business. And so if your insurance covers your primary care visits, it will cover your MedStar eVisit visits as well.
Perfect.
Um, and if you don't have insurance or don't wish to use your insurance, we take cash as well. Um, we will see kids. We will see people who are 100. So the entire age spectrum, uh, DC, Maryland, and Virginia, insurance, no insurance. Um, so again, that's pretty much everybody.
Okay. Awesome, awesome. And I think you touched on this as well about the providers who are available to give that treatment and deliver that patient care.
Mhm.
When a patient does use MedStar eVisit, could you share a little bit more about who those providers are? There's that connection because if you're a MedStar Health patient, they have access to your full chart. They can, give a little, they have that background already. You don't have to, there's no feeling that you have to start from scratch.
Right.
Could you just elaborate on the benefit of that?
Yeah, so our providers are employed by MedStar Health. They are MedStar Health providers. And we have a group of people who do that work. And some people, that's their full job with MedStar
Mhm.
Health, meaning their entire job is about MedStar eVisit and the virtual urgent care experience. We have a good number of people who also do this part-time or PRN, meaning some of the time they're in our urgent cares, some of the time they're in our emergency department seeing people in person, right? And that blend is a really important blend to make sure that like we have folks with all kinds of different sorts of experience who continue to see people in person, who continue to do other types of work inside of MedStar Health, usually emergency departments, urgent cares, some primary care clinics, but that's become less common over time. Um, that group of providers is physicians, nurse practitioners, PAs, who provide that care, and some of the folks that are the real sort of full-time versions of folks who work on MedStar eVisit have now been doing that work for 6 years, right? So like
Mhm.
really ramped up our
Yeah.
sort of core group and capacity, during COVID. So we have folks who've done literally thousands of virtual urgent care
Wow.
visits with patients and have developed real expertise, not just in the medical care, but also how to really engage with patients over video. What exam features you can extract from video that may actually be surprising in terms of understanding someone's breathing, someone's skin findings. You can get an enormous amount out of video. And the more you do it, the more expert you can become at really engaging with a modality, which certainly people use a lot, but our
Mhm.
experts have become really good at it. Um,
Okay.
and importantly, like I mentioned, attached to your records in MedStar Health, and others, right? So our providers,
Mhm.
if you don't have an extensive record at MedStar Health, but your records are inside of the regional health information exchange, or you're getting prescriptions that are capable to be found in the prescription drug management program, like bringing all of that data in to really get
Okay.
the full context of what your previous experiences are, what your medications might be, making sure that we're really making a safe and effective decision, not based on just the time we have with you, but the full context of your care and the documentation that happens then and there is right in line with the rest of the documentation, right? So
Mhm.
if you're a patient who's seen on MedStar eVisit this afternoon, your primary care doctor is going to have that note in the record to make sure that's all aligned with all of your regular care. And
Wow.
if we decide, we actually are going to need to move you to the urgent care, that continuity is there. There's a note that goes to the urgent care to say, we weren't able to sort this out with Miss Carter on our video. She needs this thing at the urgent care. She's on her way. This is what to expect. And really like arriving in that acute care setting with the context that makes it easier for that next step.
That's awesome. That's really good to hear, especially from as a patient perspective. I've used MedStar eVisit for myself,
Yep.
my husband, my kids. You're already not
Yeah.
experiencing the best moment of your life at the moment. So
Absolutely.
it's nice to know that whoever you're going to speak to, whichever provider, they have that good that bedside manner still matters, as whether
I
you're
think
seeing them virtually or in person.
wonderful point you bring up about MedStar Health employees and associates, right? So it's a privilege to take care of our own, like to take care of ourselves, right?
Mhm.
And I think one of the populations that we've always tried to engage with is our own MedStar Health associates and making sure that we provide the service that they need in their homes and that we like we are us, right? And we're taking care of our own, and that's a real privilege. And I think the MedStar Health associates that we take care of, we really take a lot of pride in that.
Thank you. It's greatly appreciated. We thank you so much for that. If you're just joining us, thank you so much for tuning in. My name is Mishan Carter, and I'm joined today by Dr. Ethan Booker. Today, we're discussing how, when, and where to access healthcare you need and exploring the convenience of MedStar eVisit telehealth for virtual urgent care. If you have any questions, please feel free to share those in the comments below. We're going to take some time to answer those as well. Right now, I want to talk about a little of the conditions that we can treat and specific types of health concerns that MedStar eVisit can help patients address any time of day, any time of the year. So, what are the most common conditions that patients currently use MedStar eVisit for?
Yeah, it varies a little bit seasonally,
Okay.
both in terms of the volume of folks coming to see us, and in terms of what their conditions are. So certainly, like in the midst of cold and flu season, you'll see a lot of that, cold, flu, what we call influenza-like illness. So the cough, the runny nose, the congestion, sinus issues, allergies. Getting through a little bit the allergy and pollen season. We see a lot of that. I mentioned earlier to you beginning to look out for tick bites, which is a thing that begins to be
Yeah.
occurring about this time of year as people are getting out. Uh, and actually, like a significant issue in parts of our geography that is a great example of something that could be seen from the woods if
Oh,
you
wow.
needed us. and you had your phone with you. So but there's also, burns and minor injuries and things like that, musculoskeletal concerns, knee pain, back pain. Some of those are a little tricky, right? I mentioned
Okay.
before, some folks need x-rays. A lot of people don't. Um, and can be started off on a direction of, say, this is something that physical therapy would be a good idea for. That's the right route to go. Um, I think that, a thing that we sort of commonly emphasize is, yes, there are some common things that we take care of. But like the whole point of having that 24/7, 365 access is we can take care of you as you get started and get you to the right place.
That's awesome. That's great to hear about the options and the accessibility to, like, if you're any like you're hiking in the woods and you have like, what is this mysterious spot on my arm or my leg? No need to panic. You can just call up your
Yep.
provider on MedStar eVisit. That's really good to know about that accessibility. Um, are there any health conditions or concerns that patients can speak with a MedStar eVisit provider about that you might not think could be treated virtually?
It's a good question, and I think that there certainly are things that come to attention sometimes that are trickier to sort out about what's the right thing to do. So a headache is a very good example of
Mhm.
something that really could run the gamut of something simple, something straightforward, something we see on MedStar eVisit all the time that can be readily managed, but something that
Okay.
could be more serious, right? And so
Mm,
headache's a good example of something that you might be able to sort out in a telehealth visit that some people might be surprised about. Um, Abdominal pain's another one that is really quite dependent upon exam. Like physical
okay.
exam is actually an important part of making good decisions about abdominal pain. But often the kind of right step for timing, we can help with that
Okay.
kind of thing. Also, nausea, vomiting, another one that sometimes can be something more serious, but often if it can be sort of straightened out with, you know, my I ate something funny, so did one of my kids. Both
Mhm.
of us have this like thing. We're kind of miserable. And that's something, stay home, drink Gatorade. I'll send a prescription in for something to help you with your nausea. Those are things that can be resolved over telehealth and through MedStar eVisit that may not necessarily be your first
Okay.
instinct, but certainly can be addressed. And then if those kinds of things need to be escalated, they can be escalated to exactly the right spot.
Okay. Um, and it's interesting that we only treat, non-recurring UTIs in females. Could you explain a little bit more about that?
Yeah, I think this is an area where I would probably again make the distinction between what MedStar eVisit does as an integrated into MedStar Health
Okay.
and our serious commitment to quality and safety, and also antibiotic stewardship. This is probably the area where patients seem to have um, the kind of the most I'm not going to say it's frustration, but the most sort of like places where we are going to reroute you to another source of care where folks
Okay.
really feel like this could just be resolved with an antibiotic prescription. And the reason for that is actually, especially recurring urinary tract infection is often not the standard kinds of bacteria that are going to respond to first line treatment. And there's something that's going on that actually requires culture,
Mm,
meaning you have to do a urine culture. You have to actually be sure that that's what's going on. Recurrent treatment of UTI with kind of the same first line antibiotics without getting that information from urine culture is really not good practice.
okay.
And so that's the reason why if someone says, I haven't had a urinary tract infection in years. This feels just like the urinary tract infection I had years ago. That's a thing that we can treat on MedStar eVisit. If it's a circumstance of I just had a urinary tract infection 2 months ago, I've got another one, that's actually something that requires testing.
Okay.
Um, and it's the kind of thing that, again, that context of having the ability to say, this is actually something you need to either see primary care or urgent care and go get more testing about is the reason why you go to a health system as opposed to going and just sort of signing up. Because to be honest, a lot of folks that are just sort of like online may actually prescribe that. And it's sort of meeting a customer satisfaction demand, but it's not the right safe thing to do. Um,
Okay.
the distinction you also made is males and females. Urinary tract infection in males is not a very common thing and
Okay.
requires more testing.
Okay.
Very rarely is that something that should just be treated without some very specific testing. And it's an interesting one to dive into both of these issues to kind of again settle our virtual urgent care in the context of a system. Both, hey, that's something you need more testing about, and here's where you can go, and I'll help you get there, is a very different experience than saying, well, maybe this isn't the right practice, but I'm just going to prescribe something to keep you happy. Like we are not going to do that, right?
Okay.
We are an organization that's intensely focused on quality and safety. And telehealth's an interesting domain in which we strive very hard to make it easy to download the app, make it quick to see us, trying to meet many of those customer experience foundations that are an important part of how a lot of people get their care, how they shop, how they do all kinds of other things. But it's still healthcare, right? And we
Mhm.
still have a responsibility to make safe choices and help people get the guidance that they want. There's a fine line between consumer and patient. We try to deliver
Mhm.
an exceptional consumer experience, but there's still a responsibility of a provider and a patient that's different than a pure consumer experience.
That's a nice distinction there. Thank you for explaining that. We talked a little bit about insect bites, um, those type of minor injuries. Why do we treat minor animal, human, or insect bites and minor motor vehicle accidents? Can you explain why, and then also take us through that process of what the patient would have to do to receive that care?
Yeah, I think, minor is always in the eye of the beholder.
Right, you're
So,
right.
right. As we started with, I'm an ER doc. I've worked
Mhm.
in urban emergency departments my whole career. What I consider minor and what others consider minor may be different.
Maybe different. You're right.
But I think many of those bites, insect
Mhm.
bites, animal bites, many of those things are actually relatively straightforward. And they need good hygiene, soap and water. And there are some circumstances, depending upon where the bite is, what are the circumstances where antibiotics may be appropriate. Not always, but sometimes. And it's an important thing to actually see somebody, go through that entire context, look at the wound itself, really understand a bunch before you decide are antibiotics appropriate or not appropriate for that circumstance. Usually they are not about bites. Now, human bites are an interesting one, right? Because human bites, actually, there's almost always a story to why there's a human bite. And again, the context of that may mean, yeah, you came to see me about the bite, but what happened? What's going on? Are you safe? Are you in a place where you can safely have that call? What else might need to be addressed? And so I think it's often one of the things that is an important part about being accessible 24/7, 365, accessible, where you can go out and sit in your car, use your phone, do
Mhm.
this connection is we might actually start a conversation about a minor injury, but actually evolve into a conversation about a different kind of help that's needed.
Right.
And
Okay.
again, that accessibility, the ability for someone to sort of find the private space they need to have a conversation they couldn't actually like take off work from or disappear from home for hours and hours to go and see somebody. I'm not going to say that's a common circumstance, but it's a thing that when you've been taking care of acute patients for long enough, you begin to recognize something about this situation's not quite right.
Yeah.
Why are you having this conversation in the car or those kinds of things? Not driving. We always
Of
stop people
course,
from driving.
yes.
I'm not
Correct.
going to continue a call if you're driving. But people do a lot of this stuff from their car because it's a safe and private place. Minor motor vehicle incidents. Again, don't do an e-visit while you're driving.
Yes.
If you're in your car, you pull over. Car and you're driving, we will stop the call. That's always been that's true of all of our telehealth policies. Um, many minor, like cars are wonderfully safe compared to what they were years and years ago,
Right.
right? So the airbags and the seat belts and the crumple zones and all of that kind of stuff make cars wonderfully safe. But being in a car accident can still hurt.
Yes.
And having both the reassurance that you're okay, and making a plan for how to manage your symptoms, can be something we can definitely do over telehealth. And then also recognizing maybe there's more subtle things that say you should go in. But a lot of accidents, motor vehicle accidents, bicycle accidents, stuff like the severity of the injury is so contingent on the story, on the context, right? So why people get taken to a level one trauma center for their car accident is very specific, right? A rollover, ejected, not restrained, um, you know, intoxicated, all the things that actually lead to sort of major
Right.
trauma interventions. But for someone who's wearing their seatbelt and gets in a fender bender, they may in fact be quite sore, but the chances that they are seriously injured are phenomenally low. And
Mhm.
so telehealth is often appropriate for that kind of visit.
Okay. And now that we've talked about those conditions that can be treated with MedStar eVisit, how do people sign up?
Yeah, so super easy. So you can go to the App Store, download the app, and sign up. Takes a few minutes. You can also hit links from MedStar eVisit from medstarhealth.org, if you search for telehealth. If you Google search telehealth, MedStar eVisit should pop up for you if you're in our region, and you can start it from the web and sign up for that there. In many of our offices and other locations, there are QR codes posted that take you to the App Store to download it. So we try to make sure that it's in lots of places, and that it's easy to do. So free to download the app, pretty quick to register. It's helpful if you have your insurance information handy, to kind of
Okay.
complete your entire registration. It takes a few minutes. Like I said, it's not just a Google search. We do need to make sure we know who you are and that um, so that we can attach your records to your visits. But it just takes a few minutes and it's pretty easy.
Okay.
Most people do visits by phone.
Mhm.
So while it's available to do on the web, so you can certainly do it from your laptop, the majority of people are using their phone to
Okay.
do visits. And so that means you got to have a smartphone because you got to have a camera on it, and internet, although it doesn't take as much bandwidth to do video from your phone as it used to. And our
Okay.
platforms, we keep trying to make them better and better to use less and less bandwidth so that we can be accessible to more and more people. But again, we've tried to make it as easy as we can and accessible. I think that's an important part of the platform is that if you need an interpreter. So if you need Spanish interpreter, if you need ASL for the deaf community, those are things that are embedded into the platform so that we make
Okay.
sure that we're accessible. And we have worked with the deaf community in particular, and with our marketing and communications team to make sure that it's readable, it's accessible, like all of those things are really important to us, not just because it meets our community obligations broadly, but because ease of use matters, right?
Mhm.
With digital experiences, if it's frustrating or if it takes too long, people quit. And we want to make sure that if you come to see us, that we can deliver on that promise.
Absolutely. Absolutely. What is the typical cost of a MedStar eVisit?
Yeah, so it's like I said before, MedStar eVisit takes the same insurance that MedStar Health primary care offices take. So we have we're basically within the same business. And so if your insurance covers a primary care visit in MedStar Health, it'll cover um, a MedStar eVisit. The same copays and co-insurance, so the same out-of-pocket cost for a primary care visit applies for MedStar eVisit, including deductibles.
Okay.
So for any particular individual, it's often hard to say where you are on your deductible for this year, to give them a very precise amount that's going to be their out-of-pocket cost, but it's the same as what a primary care visit would be. If you don't have insurance or don't wish to use your insurance, because sometimes folks copay, either their deductible is such that they actually don't want to hit their insurance, we do offer a cash price of $79 for the encounter. And we have the mechanism to collect by credit card for that.
Okay. Okay. Thank you. Right now, I want to take some time to address our audience questions, and thank you very much for tuning in, continuing to share your feedback with us. Um, Also, the link to learn more about MedStar eVisit and to download that app is in the comments as well. So be on the lookout for that link. I have a question from Kelly about this deals with location, and we touched on this a little bit earlier, but if you're visiting the DMV area, can you use MedStar eVisit? Is it, just for folks who live here full time?
Nope. Yeah, excellent question, Kelly. So if your feet are anywhere in the district, Virginia, or Maryland, you can be seen by MedStar eVisit. The location question is interesting, though. So one of the
Okay.
questions we commonly get is, hey, I usually use MedStar eVisit for simple things. I happen to be traveling and I'm in Tennessee. Can I use MedStar eVisit? The answer is no.
Okay. Okay.
So medical licensing requires that the provider is licensed in the state where the patient physically is. So now we have some circumstances in which we're providing continuity. So if you have a primary care doctor and you're traveling and you're reaching back out for that primary care doctor within the context of that established relationship, there are some variabilities there. But for MedStar eVisit, inside the district, Maryland or Virginia, absolutely okay. Outside of
Okay.
those three states, we don't offer services.
Okay. Gotcha. Thanks for clarifying that, and thank you for sharing your question, Kelly. I have another one from Tiffany. What should I have ready before starting my e-visit?
Great question, Tiffany. Thank you for asking. I mentioned about registration. So when you do your registration, having ID and your insurance, just like you'd see in
Okay.
any other office visits, really helpful to do that registration. Once you've done that registration, as long as your insurance information hasn't changed, you don't need those cards again. Um, it is helpful to make sure you actually have a little bit of time to do the visit. It's not infrequent then someone says, I'm ready for my telehealth visit, then the doorbell rings or the
Right.
kids get home from school or something else happens that interrupts that. That's fine, come back later. But it's going to take a few minutes, usually just a few, 3, 4, ideally not much more than that, to wait to be seen. And then most of our visits are pretty quick. So as short as 5 minutes. It takes a little time to make sure we're really doing the right thing. Sometimes visits are longer. So it's obviously quicker to get started and do that from home than it would be to get in your car and go someplace.
Mhm.
But the time is useful. We'd like to be able to see you. We can't really deliver a video visit if you don't have a camera on your phone that allows us to see you. Um, you know, in the application itself, it asks to make sure that you allow your mic and your camera,
Mhm.
just like when you do anything else,
Right.
so that we can see you, and that you're in a safe place. Again, if you're driving the car, we'll
Pull over, yes. And
wherever you're
park.
gonna have the visit. One important thing, Tiffany, to make sure that you do have is if you're trying to do a visit for your kid's got to be there.
Okay.
So that's been an area that occasionally has happened where, we get a call from mom and mom comes on and says, my kid has this rash. And we say, okay, let's look at the rash. And it's like, well, the kid's at school. And it's like, well, it's gonna be hard for me to figure that out. So if you're getting a visit for your kid, make sure you bring your kid.
Good point. Good point. And thank you so much for answering, and thank you so much for sharing that question with us. Um, I have another question from Caleb. Can I use MedStar eVisit if I don't currently have a primary care doctor?
Yes.
Okay.
Yeah, so good
Okay.
good question, Caleb. Just like in urgent care, if you need us, we will see you. So absolutely get started with MedStar eVisit if you don't have a primary care doctor. And I think this is an important distinction between, again, what you can get from MedStar Health and MedStar eVisit versus going to the web and looking for virtual urgent care or telehealth.
Okay.
Is if you've got an acute issue that we can resolve, we will resolve it for you on MedStar eVisit. And importantly, do our best to make sure we get you connected to ongoing care, right? We have terrific primary care doctors throughout MedStar Health. Our primary care doctors also have the connected primary care program. So that means nurse practitioners that are part of our primary care footprint that offer about 500 slots a week for established patients for same day and next day appointments, which is ideally going to open up more capability for new patients to get access. I know
Okay.
it's super challenging these days to find the new primary care doctor, and folks are frustrated by wait times. And so MedStar Health has built these programs to kind of create to work on creating capacity for primary care. Okay, the thing that I will caveat is MedStar eVisit is not a replacement for primary care. If you
Okay.
don't have a primary care doctor and you need something, come see us, and we'll do our best to resolve that issue and then get you attached to primary care. But management of chronic diseases like hypertension and diabetes, and I need these 6 medications refilled, and that's not an ideal use for MedStar eVisit. But you don't need to have an established relationship to start with us. We're a great way to get to know MedStar Health.
Absolutely, absolutely. Um, Thank you so much for sharing your question, Caleb. I have another one from Matthew. If I'm not feeling well late at night or on the weekend, can I still use MedStar eVisit?
All the time, 24/7,
24/7,
360.
yes.
Like if you feel lousy after Thanksgiving dinner, someone's on the platform. Right? You feel lousy, New Year's Eve, Christmas Day, doesn't matter. We're here.
Okay, awesome. Or 2 a.m. wake up with your 9-month-old. Don't feel bad about calling
Oh,
or doing a
totally.
virtual visit.
Yep. Yep.
Okay. Okay. Good to know. Um, and we had a question from Randy. We touched on it a little bit earlier, but could you just, I guess, reiterate the point about he's asking, what if I'm not comfortable with technology? Can I
Sure.
still use eVisit easily?
Yeah, I think so. I mean, I think people's level of comfort with technology varies obviously quite a bit. But I'll tell you, Randy, that if you got onto this Facebook Live, you can probably get on to eVisit.
Yes.
So obviously in the chat and comments, there'll be links to download the app or get started on the web. If you're more comfortable sitting at a laptop and doing it by web, absolutely do it that way. If you'd rather not have an app on your phone, I obviously have the app on my phone, but like I'm getting pretty choosy about which apps I put on my phone because it's starting to get
Right.
crowded.
Okay.
I think this is a good one to have. Um, but I think downloading the app is probably the sort of easiest way to get started. And once that's on your phone, it really is quite easy to get connected. It's not quite as easy as a FaceTime call. Um, and again, because of the privacy and security and making sure we're connected to your records, it's probably never going to be quite as easy as a FaceTime call. Um, but I think that again, the point that I made earlier, Michelle and Randy, that I would emphasize is the I think the technology we will continue to work to make as easy as we can. The most important part about sort of getting care this way is that you trust the provider. And we've worked very hard to make sure that our providers are well trained for this modality.
Mhm.
Great providers, but also supported in this modality, and we provide support with a support team all the time as well. Um, and then that we are MedStar Health. It's not something that we outsource. It's not something that we're contracted for. It's not something that anybody else is providing. It's embedded in your experience. And I think that's equally important to the technology experience.
I agree. I agree. Thank you very much, Dr. Booker. And thank you so much, Matthew, for sharing your question, and Randy. So as we wrap up and close for the day, what is one key takeaway you want people to remember about MedStar eVisit telehealth and virtual urgent care?
And I think it's there are a handful of things. I'm never going to choose one.
Okay.
Um, so
Okay.
I think that immediate and continuous accessibility, right? That MedStar eVisit is not the only front door to MedStar Health, but it's an important front door to MedStar Health for the things that are simple and that we can resolve, but also for that uncertainty to make sure that we are always here and available to you, and that we're a front door that you can choose, and it's we will help you get where you need to go. Um, I think alignment to primary care, both as a business principle, meaning same insurance, same approach, same copays, but also to make sure that we maintain that continuity, whether that means helping you get a primary care doctor if you don't have one, getting you returned to your primary care, making sure your primary care context is within our visit. And also the continuity to urgent care, emergency department, that kind of thing. And I think that question of like transition to the right spot of care is probably the area where I spend more time kind of talking about the experience and making sure that we don't just talk about telehealth as a destination, but telehealth really as a way to open up a new way to deliver care, to bring care into the home, and to give people that accessibility.
Awesome. Awesome. Thank you very much for sharing that, Dr. Booker. That brings us to the end of our discussion today. We really appreciate you taking the time to answer our questions and sharing your expertise, Dr. Booker. Thank you to everyone for tuning in and joining us today. MedStar eVisit Telehealth makes it easier for patients to connect with trusted MedStar Health providers for urgent healthcare wherever they are in our service area. For more information or to download the app, please visit our website using the link that's pinned in the comments below. Thanks again for your time and have a great day.
Thanks so much.